Okay, we're going to start our next panel. It's my privilege to introduce Representative Susan King from Abilene. Susan and I came into the legislature at the same time in 2007, and she's been remarkable. She is bright, energetic, knowledgeable, hardworking. She represents her district. She is a nurse by profession. She is married to a doctor who is president of the Texas Medical Association. Is that right? This year?
That's correct.
And travels a bunch, but very knowledgeable on health and human services issues. She serves with me on appropriations. She has served on Article 2 of the Appropriations Committee. Will you help me welcome Susan King, and she'll introduce her panel.
Thank you, and thank you for staying. I think this is the second to last panel. I think a lot of people stayed to hear John Sharp and then ran out to go back to their towns, which is totally great. I don't know how many of my colleagues are here in the room. I know I saw Ken King, no relation. We used to have 3 kings in the house, now we have 4. That was sort of a joke that no one really got. We didn't sing about it, but nevertheless. So if there are any other colleagues here, thank you to Phil, and I don't know who else is in here that's important, but you're all important after all. And thank you to San Angelo and all the different facilities for having this today. What is going to be discussed today is healthcare and the impact that the energy sector growth, i.e. all the great things in the Permian Basin, et cetera, have on healthcare. Drew gave me a really nice introduction. I will tell you that one thing that if you say right now, I really don't have an interest in healthcare. I'm all about the energy sector and whatever. I totally understand that. But quite frankly, we always say you cannot escape death or taxes. And now you probably can't escape the Affordable Care Act. That's not a political statement, it's a fact, at least for today. So we do know that healthcare has a different impact no matter what the change is in the demographics or the industry growth in the state of Texas. I am a practicing nurse. People ask me all the time, so when did you last see a patient? And I would say yesterday. I saw a patient yesterday. I own my own business, a surgical center. And I don't have the money to have a big staff, and a lot of people don't stay in their jobs very long these days. I hate to sound like my husband's grandmother, but these young people just don't understand the value of working hard. And that's all I'm going to say about that. So, these great people to my left, I've just met this morning. I don't know how expert they are on speaking to people. It doesn't matter. They are experts in what they do and their contribution to this panel. So, let me say, this young man who looks like you work out a lot next to me here. Sorry. I couldn't help it. He said he was a troublemaker, and I'm known for that as well, so I just thought I'd just launch that up. So this is Bradley Robinson, correct? All I'm going to say about him is he's an oh, that was a Freudian slip. ASU grad, of course, Angelo State University. The next person down the row would be Christy Dyer. She's also an expert, and I didn't see where your training is from. Where did you go?
Angelo State for a little bit, Howard College, Cisco Junior College in Abilene.
So she's multi-talented. She went to several counties to give her money for her education. And so that's Christy Dyer. And then to the far end is Danny Updike, and Danny also from Angelo State University. Imagine that. So that's fantastic. So it's totally hideous and boring for me to read or say anything about them. So let's just do that, shall we? Beginning with you, if you would say a little bit about yourself. Don't go on and on, or I'll have to stop you. And then say, just briefly, why you think this panel is even important to talk about the impact of public health and safety with regards to the vastly growing, proliferating oil and gas segment and energy segment right now in the state of Texas. So this is Bradley.
And I go by Brad, so
Oh, Brad.
But that's okay.
I'm going to change that right
Normally
now.
when I'm in trouble, I'm Bradley, so that happens quite often. I'm currently the clinical nurse manager at Midland Memorial Hospital. My employer and my direct supervisor happened to plan his vacation around this, so I'm here by default. We deal with chronic wounds, diabetic wounds, those sort of things on a basis, but with the influx of what's going on in our region right now, we're also seeing more acute wounds. The crush injuries, the chronic ankle that won't heal after surgery, these sort of things are what we're seeing and what we're dealing with right now as far as some of your employees who are out there actually quote unquote in the trenches. I dealt with it on an EMS level. I was fire and paramedic for years before I went on and decided to wise up and work in an air-conditioned building rather than out in the heat. But that is what we mainly see these days. Part of what Mr. Chancellor Sharp said in dealing with the diabetes and combating that up front prior to it being a real problem would hopefully put my department out of business at some point. And that's really what we're looking to. I think that's, did I answer your question?
Yeah, fantastic. And see, this is the thing, there's no right or wrong answer. Because depending on your background, you can say whatever you want. And so then, at some point, when we have Q&A, then you can test him. You can test Brad. And I appreciate the comment about John Sharp. I wasn't stuck. I ended up in a conversation and missed, I hate to admit, that. So I really am curious to hear more about that at some point, about the diabetic concern, which we have a growing population with that, especially type 2. With John Sharp's interest in that, I really am curious. So, Christy, please.
Okay. My name is Christy Dyer. I'm from Glasscock County. I believe that I was probably asked to be on this panel because I represent the frontier and rural areas of West Texas, which my county, Glasscock County, mirrors a lot of what we see in those other areas. The only health care that we have in our county is our volunteer EMS service. And so that means that I have people that are getting off tractors when they're called to come and take care of their community. They began their EMS careers because they had a heart for their community and for their community members. And with this influx of the oil and the energy sector, we are now, it's okay. We're now taking care of, and those volunteers are now taking care of a lot of the oil field workers. And that's caused a vast change for the way that we provide health care and the health care that you're going to receive. And so I think that was probably
Fantastic. And I have a couple of questions for
Okay.
you, but I can ask you right now because they'll think, well, why is she asking that now? So just to, if you don't mind. Would you define frontier area? I know what it is, but this is kind of an interesting concept when we're talking about distribution, availability of healthcare. Could you explain the frontier concept?
less than 6 people per square mile. My town has about a population of about 300. Our county has a population of about 1,200. Anytime during the day, I believe that it probably triples at least in population. And those are not people who are citizens of my community. They're people that are in working.
Okay, another question. How are you defining a volunteer EMS, emergency medical services, in personnel, the same as a volunteer fireman? Is that within the same realm? I mean, they're doing this with their own money for their training, and they're not employees here, of course, but they have their own jobs. Is that accurate?
Yes, they're very similar. In my county, both services are volunteer. And we do have community support and county support for both departments. However, the employees of those services are not employed. They are volunteers. And that being said, they all have full-time jobs. They are not committed to that service at any time frame for any time shift. They are doing what they're doing on a regular basis, and they stop when something happens and stop their activities, stop their church, their whatever it is, their school function, whatever it is, and leave and go get on an ambulance and respond to whatever emergency it is that someone has in our community.
One more question. So with regards to that, they stop their paid job. But this is no obligation, this is no state law, this is no statute, that is no requirement that the paid employer would release them. Is that accurate?
That's correct. That's correct. And we're fortunate that many of our people are self-employed. They are farmers. They still have deadlines. They still have things they have to do. But yes, and that's one of the things that we fight on a regular basis is that people don't have to let those,
Right.
employers don't have to let those people off.
Thank you so much. That's important insight. And so now at the far end, we have Danny Updike.
Good morning. I'm originally from Kentucky, but I got to Texas as fast as I could. I've been here about 23 years now. After coming to only stay a year or two, spent my first winter in San Angelo and decided I wasn't going back. So, love West Texas. I'm the executive director for the Concho Valley Regional Advisory Council. We were formed about 20 years ago by the Texas Department of Health and Safety, DSHS. So we're completely funded by a state organization. And I work with all the hospitals and EMSs in a 14 county area. And we help them to get state grants for trauma care, disaster preparedness, stroke care, cardiac care. We do injury prevention, provide education to hospitals and EMSs. And so what these people see on a single base, whether they're ambulance service or their hospital, I deal with for a whole 14 county area, seeing the effects of the energy boom in West Texas.
Okay, so in the world of acronyms that we all love to be irritated by, would you explain to them DSHS, what that is?
Texas Department of State Health Services.
That's a huge agency. They're undergoing sunset right now, which is looking at efficiency and the amount of money and the budget and personnel and stuff. And so there's some attempts now to pull that down. My question for you would be, if those grants weren't available, what would be the economic impact on the ability to deliver health care in your area?
It would be a huge impact. We've taken several cuts over the last few years. We took a 36% cut in our disaster preparedness grant just this year. And it's had a huge impact. We can't provide help to the hospitals for decon supplies and training and to update their plans. On the EMS side and the trauma side, a lot of the money that we get goes to help these services that are volunteer and don't have paid staff and don't charge for their services, to provide them with equipment and stuff, to update their equipment, buy new supplies, and just pay their bills. Because just like Christy, a lot of the services that I deal with, they don't charge really for their service. I mean, they go out and pick you up and take you to wherever you need to go, and they don't bill for you because they don't have the infrastructure in place in the county or the service to charge.
So decon supplies, what does that mean?
Decontamination supplies.
Okay, I figured that's what it was, but
Right.
we have to assume now that the majority of these people are not major healthcare experts, but they could be. Now, I'm not going to ask you to raise your hand, but there could be those of you out there that are not up here, and so we have, but by and large, just if you would elaborate on that just a little bit, because I do think it's important when we're talking about state funding and we say, well, it's cut this percentage, what does that actually mean? Is there fluff? Is there things that you could have done without so the cut is not significant? Or you, as boots on the ground, know what it does or doesn't mean with the cut. So as legislators, you know, Representative Darby and I, we like to know if there is a cut, we don't just arbitrarily put in a percentage to be fiscally responsible and prudent and more efficient. We need to know what it is we're cutting with that's behind the number. So if you wouldn't you elaborate on decon supplies and some other things that is a result of the cuts being made.
Yeah. So for the first few years when the cut started, you're right, we were able to trim the fluff and that type of stuff. But the cuts that are coming now are affecting services that we provide. Our organization started out when we were formed 20-something years ago by the Department of State Health Services, was pretty much a volunteer organization. There wasn't a person who did my job. These regional advisory councils were formed, and people volunteered to be on the boards. And so my board is one person from each hospital and each EMS agency in the 14 county area. So I have 25 bosses really. But then as the requirements for the state funding, the paperwork, the responsibilities grew, people didn't want to volunteer their time. I mean, they didn't have the time because they had full-time jobs. And so a position like mine was formed in all 22 areas. So there's 22 of us, and we cover the entire state of Texas. And the funding at that time allowed them to be able to pay somebody to do my position. And really what I do is I follow their guidance, but I make sure that they all do what they need to do to keep getting their state funding. So they pay me and to be able to keep getting their grant. Mandatory meetings in Austin, mandatory, paperwork to file. All of that is we're getting close to the point to where my job will go away. They won't have the money to fund my position. So then, more than likely, the whole organization will fold.
And I want to comment, you hit a very salient point, which is the regulation, the paperwork, the accountability, with any grant, with any money, we're not just doling out money. Some people may think that's the case. But the accountability piece and the reporting back is tremendous. And it's sad because I think in so much healthcare now, the focus is away from healthcare, the focus is away from the patient, and it's all about the regulation. Of course, that's not to say we don't want to be accountable, but it's become untenable. And with the duplication of efforts from the state and the federal government, almost asking to do the same thing. It's a little bit similar to No Child Left Behind on the education side at the federal level, and then what we require for the state accountability system. It's very similar. And so why then do you have to do both? You have to report the exact same things to the state and to the federal government. And it's very exasperating, and this has an impact on the workforce, in my opinion. People are sick of it. They don't want to do it, and yet we have no choice, because now the way it is, if you don't do it, the repercussion will be that your reimbursement will be cut or you won't be paid at all. And this is a big problem, and you don't think of these things when you're a patient. So at this point, gosh, we've already had a great discussion just in your introduction. If anyone wants to weigh in on anything that's been said at this point, go ahead, and then we'll try to hit a few of these questions. And I certainly want to leave it open to question and answers, because I can see there's a lot of riveting attention being paid here. So I know that mic in the middle of the room, someone is going to want to come up there. Did anyone, Christy, you look, or both of y'all were looking like you were,
Go ahead.
very good.
Okay. I'd like to just elaborate on what Danny said.
Pull your mic a little
those-
closer, you're not as loud as some of us up here.
That's the new, yeah.
Okay, good, that's good.
I just wanted to elaborate. There are, like Danny said, 22 regional advisory councils in the state of Texas. RACJ is the one that covers kind of West Texas, and it's a 22 county region, is that correct, 22? And that funding has been cut there as well, for emergency preparedness, and just our day-to-day functions within that RAC. Part of that emergency preparedness is making sure that each county is prepared for emergencies that could happen there. And I was fortunate enough last Saturday to visit with Chief Nim Kidd, who's the Assistant Director of DPS. He is the Chief of Emergency Management in the state of Texas. And when we were visiting with him, one of the comments that he said, he talks about the law of averages and how we're just waiting for something to happen in our area. Well, you've driven through West Texas and you've seen all of those oil wells, and I know I'm preaching to the choir here. I feel like, and I hate to say it this way, but I feel like sometimes that we're a ticking time bomb. But yet that funding's been cut that prepares us for those emergencies that are going to happen there. And I'd like to see, I don't think always that the energy industry has realized the impact that they've had on healthcare in our community. And I think it would be great if we could figure out how to get those two to work together, knowing that there's funding cuts, knowing that we need them to work with us so that we can all make sure that we're all prepared together for those emergencies that could occur.
That is fantastic, and that's the purpose of this. Drew Darby.
You've touched upon a real
Absolutely.
huge issue that while we're all focused on the leasing, drilling, production, the reality is it takes people, and people that are put in harm's way to deliver those services, deliver those products, and we have a huge vacuum out here in West Texas about access to level 1 trauma facilities. And they talk about the golden hour. we
Yes,
have
sir.
a golden hour to get these employees to a level one trauma center. That's going to be one of the challenges facing the legislature this next time is how do we get funding to provide that quick access to the very people that are providing this economic stimulus to this state. So talk a little bit about the challenge. I know you're in Midland and you're pretty close to Midland, but there's a lot of counties that are not within this golden hour, and how, talk about your struggle there and how we can address that issue.
So, Christy, also, I'm sure most people understand what Representative Darby's talking about the golden hour, but will you elaborate on that? Again, I think it's hard to have a good communication unless I'm sure everybody understands what we're talking about. I appreciate your input, but speak to what that is, because that is a critical piece and certainly very impactful with West Texas.
The golden hour when you talk about emergency medicine is that first initial hour after an accident has occurred. Your best chance of survival is if you get appropriate health care within that first hour. Appropriate health care, like Mr. Darby said, is a level 1 trauma center. And our closest level 1 trauma center is Lubbock?
Love it, yes.
Lubbock. So if that gives you any indication, and I'm talking from Glasscock County, from Midland, the closest level 1 trauma center is Lubbock. So you can imagine that golden hour to get to that level 1 trauma center, it doesn't happen.
How do we staff, or I know we can't put a level 1 trauma center in every hospital in the region, but through telemedicine or technology, or how we, if we can't get to a level 1, how can we provide the appropriate medical attention directly to the rural areas here?
So, for the people who don't know, there are 4 levels of trauma center in Texas, with level 1 being the top level, level 4 being your rural hospitals, like Ballinger Hospital, Eden Hospital, places like that. Those are level 4. San Angelo has 2 level 3 hospitals, both the Shannon Medical Center and Community Medical Center are level 3s. And that's mainly the largest you see out here until you get to Lubbock. Now, there is a level 2.
Mr. Landgraf, y'all are level 2, right? I hate to pull you into this, but I voted for you, so I think I can.
So we can put representative to be, well, no, you don't have an opponent, do you? Okay, so we can say Representative Landgraf, you can come, there's an extra chair, and Representative Darby, you're getting really big in this committee, and it just shows you that it's a big issue.
If I could interject a little bit
Yeah,
on
please.
what, San Angelo has air. They have Shannon has a helicopter, which is very vital to this area. We also use services in Midland, Odessa, because Mr. Landgraf comes from a medical center, which is our sister hospital 20 miles away. And we're all right on the cusp of being level 2 there, which provides everything that a level 1 provides, except for maybe neurosurgery or some of these very advanced type of medical physicians that you need to achieve level 1. So we can stabilize these patients once they get to Midland. I think part of the problem we run into with the volunteers, and they do an excellent job, and I've been in EMS and I've been in ERs for years and years and years, and that's where my true love is to see the patients come in from the volunteer organizations. These aren't the patients like we see in Midland or we see in Odessa, just another face with an injury. This is Christy's mama, who was the babysitter for Sarah's daughter, who was the husband. You know, these are family to these folks. And so the volunteer organizations do an excellent job with the limited resources they have of stabilizing these patients to get them to advanced care. I think part of the problem is the frontier type of area, and moving with that to have a sustainable partnership with your oil industry, or the folks who are putting those people in the field who are not necessarily trained to the level of the volunteer, but trained enough to sustain that person until the volunteer gets there, are some of the things that we see as on the receiving end versus on the instigating end. And that's the thing that I think where the gap is in that first 15 to 45 minutes to get all of this activated and moving the right way. I think that's some of the things that we need to look at on a basis for the patient. And I'm a nurse and a paramedic by trade too, so most of the time I speak directly to the patient. I don't really care how we pay for it. I want to fix the person that's in front of me. And I leave that to the smarter minds that do finance. But I think that's where we see is because there are so many people in your area working on a daily basis, it really strains these volunteers, and they're having to leave their normal job more and more to take care of these folks, which they do not mind. But it's just a fatigue factor of not dealing with that every day, I think, has caused some strain there.
Bradley, I'm gonna set you straight.
Oh, no. Oh, wait a minute. Everyone, write this down because we're having a discourse with the panelists.
There we
Go
go.
ahead, Chris.
And you're absolutely right, because my volunteers, that was the reason they started, was because it would be my mother that they were going after, or, sorry, Danny, and Sally. And that's who they started, that's why they became volunteers. However, we've gone from about 10% Aunt Sally's to about 90% oil now. And it's not where Aunt Sally's calling and saying, hey, Christy, can you get a couple of people together and come get that ambulance and come pick me up because I'm sick and I think I need to go in. Now it's some guy calling and, calling 911 and saying, I fell off an oil rig and I've hit my head and it's busted open and I think I need a level 1 trauma center. And so we are volunteers. We are a basic service. We can get into that, but there's 3 levels of EMS service. We are a basic service. And so we will do our best to stabilize that patient and then take them to the next level trauma center, whether that be a level 1, 2, 3, or 4. But we are doing what we can, and Bradley, you're absolutely right, Brad. Sorry, you're not in trouble.
Well, you're sitting straight.
There you go.
But what I find, to address the issue directly, is that a lot of the laws for the paramedic certification have changed. And as those have changed, now it is a much longer course. It's at least a year in most places. It has to come through an accredited school to get that education. And so when you look at the highest level care that a patient can receive in an ambulance, it might work for Odessa, Texas, to say, you know what, we're going to send you to school, or we want you to go and pay for that education, and then you come back and we're going to pay you really well to work in the back of that ambulance. However, in Glasscock County, my volunteers are the guy who gets off the tractor. Now let me tell you, he cannot afford to go and spend a year and miss his $500,000 a year job to be in school for a year to come back and volunteer. So it's made it very difficult to get that education. And what I'm finding too in my area is that the oil boom has happened so fast, and I think most of us were not prepared for this. And so the catch-up seems to be a lot slower than the oil boom was. And so we are working toward these things. We're working toward trying to charge for our services so that we can provide better things, greater things, and so that it will offset some of this cost. We are looking at greater education. We have created our own continuing education program in our region, in our area, in our county, so that we can educate our own people. I'm looking at some other educational programs. We're supposed to be starting a new advanced EMT class in October, which will hopefully get us some better skills so that we can better take care of some of these people. But it's a very, very slow process, and getting that education in our area and getting our people to take time off to do that is very difficult.
Well, I'd like some specific tools that you need to provide these services to the folks you serve in this West Texas region. Because, we bought 2 helicopters for the DPS so we could fly and protect the border. Okay, and that's an important function. But I think it's equally important that we provide access to the folks that live and work here in West Texas so that we can, again, fuel this economic boom, but yet not neglect the people who live and work here and the workers that are working in the oil field. So I for one, I know Susan would be interested in knowing specifically what kind of access to technology, what kind of access to equipment, what kind of access to programs that can better facilitate the interdiction of your services with the injured.
I think one problem that we.
Can I interrupt for
Sure,
one second?
go ahead.
Okay, this is such a great conversation, but I do not want to get so far into it. We close at 11 on this panel that I don't let other people in the back of the room or other than Representative Darby, who you can tell is really excited about this, and he should be, because he developed this energy caucus in the House. And so this is a really good dovetail impact, saying that, yes, we're great about all the money and the boom and the jobs and all this, but what about the human impact? So I know where we're going with this. We're going to hear about this. I think it's really good. So if we could, I would like for everybody, and I'm going to start at the end, to make kind of a closing comment. Chrissy, what you said about couldn't we get the industry and the healthcare needs and everything collaborative? I've even thought for times, how is it that the businesses that are bringing in all this revenue, what is their obligation morally or otherwise? You don't want to mandate them to do it, to help pay for some of this stuff, because it's their workers that are needing it. There's just so much, and I am remiss because I thought today, well, what are we going to talk about? And I'm just fascinated, and I won't say who, but some of you told me you had never done something like this, and I would disagree. You were extremely articulate, very helpful. So let's begin at the very end, make a closing comment. I'll wrap up a little bit, and then I want to definitely give a full 10 minutes to Q&A, because a panel that doesn't take questions, I believe is a little cowardly. So we're going to allow it. So go, you're first.
We kind of touched on the edge of, but we never really came out and said it when we talk about organizations like Christie and they volunteer, and the training they need, is the fact that over half of my counties that I serve are volunteer. The problem they're having is getting volunteers now. That guy that worked at Joe's tire shop that Joe would let off to go jump on the ambulance now works in the oil field, and he can't get off and go. And so that's the big problem we have, and I know a lot of the counties are having problems because now they're having to try to come up with the funds to actually pay people so that they have paid staff. The other thing I want to touch on, and talking about hospitals and level 1s and level 2s, is that, and I'm sure Midland, Odessa is the same, but we're very lucky. We have very good hospitals in San Angelo. Even though Shannon Medical Center is a level 3, they provide almost all the services of level 2s and level 1s, with the exception of burns. Burns are automatically shipped to Lubbock or San Antonio or Dallas, and we'll probably never see that changed out here. But as far as the other services they provide, neurosurgery, cardiothoracic surgery, all of that, they provide, right here in San Angelo.
Thank you, Christy. Because you may be answering the question, so you have another opportunity to speak. You shy wallflowers that you thought you were, but you're not. Go ahead, Christy.
I agree. I mean, our volunteers work very hard. Our hospitals are wonderful to support us. I was in a meeting in Austin a few months ago, and one of the things that came up was, well, yes, we're cutting your funding, but just get these oil companies to donate. And what we're finding out is it's not that easy. They want to donate to causes that make them look good, environmental causes, something that gives them a kind of a good feeling. I would like for EMS and healthcare in rural West Texas to be that thing that makes them look good and feels good. If you are an oil field company or you know people there, I would encourage you to have them have their safety officers work with their local EMS and find out what they can do, what needs to be done, how they can work together. Because West Texas is a great place.
Thank you, Christy. Go ahead, Brad / Bradley. It's your turn.
Just to touch on what they've both said, I think a lot of oil companies we see with their offices in Midland and Odessa do employ health clinics. They have a nurse practitioner, which does not come cheap. They have a PA, who are all under medical direction. If they had someone regionally, possibly that was paid by the oil company that could go to the advanced training or hire. Firemen are always looking for second jobs from my past life because we have families to support, to rotate through and be the paramedic in a regional area under a medical direction of a medical doctor so that they could render that first aid care and assist the volunteer when the volunteer gets there with an ambulance. Because I can promise you from working in Big Lake and working some other places that I have throughout my time, the volunteers welcome any resource they can get. And they are a blast to work with because they're eager, they're not grumpy, they're ready to take care of the patient. For those of you who haven't been in healthcare, some of us get a little grumpy at times, as probably we all do. But it's a resource that we truly need coming from the receiving end and trying to help the JRAC out with all that we do from Midland and Odessa. It's something that desperately needs to be looked at because some of these injuries are quite significant when they come off of a drilling rig or a pipeline blowout or the different, even just the automobile accidents that are going on, especially through, we were talking about the construction in our area to get back and forth between the two of us. The automobile accidents are of such severity right now that any resource would be welcomed. Anything that we could get as far as advanced training, as far as advanced equipment, just these life-saving tools that those of us in the quote-unquote San Angelo, Midland, Odessa, big cities take for granted.
I appreciate, I really, please join me in thanking these panelists. They've been very insightful, very direct, and quite frankly, very blunt, and that's what we need. Healthcare, having your foot crushed, having your head sliced open, having a potential injury, a burn, these are not everyday things that we just walk through and have. And so I think, especially the bold comments about the obligation, not that the state should come in and mandate it, we don't want any of that. But the obligation perhaps that maybe people will start thinking, hey, this is a big deal. I didn't realize there's so many percentages of people that deal with our workers that are instrumental in getting this oil out of the ground, this gas coming out of the ground, and the risky deal it is. We've always had oil field injuries, but as you say, or Drew said, we're adding people to the mix. Yes, we're grateful for the revenue and the money, and the Economic Stabilization Fund is getting bigger and bigger, but what about the people that are behind all this? So I would say, Drew, I want to answer your question about telemedicine. We do have some of that in acute care situations with stroke, and so we do have that now with regards to, and you talk about the golden hour, that's one of the most critical pieces is stroke, and you don't even think about it. You have oil field injuries, but what if some of these people, unbeknownst to them, end up having a cardiac event or stroke? And so all these things really weigh into it. I really think there's an opportunity here for the energy sector to work with public health. I know I'm going to carry this message to the Public Health Committee. I know Drew, Representative Darby is a big wig in several areas, but particularly in energy, he's doing that. So what other things? Yes, and I know of a helicopter that I'm not sure it's really that busy in Longview that we could perhaps go after, and you've heard of that. So at this point, let's please, I won't elaborate. Please, questions and go to the mic. I know everyone thinks they have a loud voice, but you don't in a room like this with carpet. So Ken Becker of Sweetwater, if you'd run right on over there, that would be great. Everyone was bragging on their town. Abilene has great health care too. I just had to throw that in. I mean, everyone loves everyone in San Angelo. It's such a nice thing. But anyway, I just thought I'd bring it up. So please go.
It's a two-part question. One
And say,
is
excuse me, say
Ken
your
Becker,
name.
Economic Development Director in Sweetwater.
Okay, good.
And I do think that we do forget sometimes the oil and gas companies are paying a lot of taxes with the stabilization fund already. So, you know, sometimes we accuse them of not being a part of, and we forget that they're paying an awful lot of expenses in the state of Texas already. Does anybody have any experience in emergency services district? And if you do, what do you think of it?
Well, I will tell you that I know that a lot of the climate now is that no one wants to put any other taxing entities, and I know that went down. A few years ago, Austin was trying to develop this. What they're doing statewide and a movement towards that, I don't know. But typically, not all, but many people are upset when they think there's any other kind of district or government entity that's being put together for the purpose of raising funds, even though it's certainly meritorious to do so. And let me just make a comment about the Economic Stabilization Fund. That's a mandate, the severance taxes have to go into that. I think we're talking about, wouldn't it be great if we could have the conversation to not mandate, not say you have to pay an additional thing, but to have people come in for the good of people and the patients and everything to do it. That's better said than done, but we know full well that that could be a possibility. I'm sorry.
No, I think it's very true, but I think just sometimes we point fingers too much at an entity that is already paying an awful lot of taxes, even though they don't have control where that stuff goes at the end.
I agree, and I've said before that I think that the oil and gas people should have a representative, maybe not a voting one, but on appropriations, because yes, they are part of that. So those that are pointing fingers, stop doing that, whoever you are. Thank you for your comment. Next question, please. We need to have at least 6 to be using our time well here.
Cheryl Pfluger at San Angelo Community Medical Center. I have a question of outreach to just not emergent situations, but just outreach to regular medical care. I know the hospitals are willing to have outreach in these particular areas, but how to deliver that care with the help of the rural clinics and with the help of people in the industry, how best to deliver that care to the oil rigs, to places where the people are staying. That's a question.
Are you talking about preventative care or just not injury related, nothing to do with?
Sniffles, colds, cuts, things that are not emergent that require level 1 or 2 or 3.
Go ahead.
I think one of the things that, and I'll be honest, I have kind of a vested interest in this. One of my very good friends works for a company he's a nurse practitioner who works with that company to do just that for their employees. And they see that, and I think in driving through Big Lake and seeing all the mobile home trailers and that sort of thing, I think seeing that as a clinic environment setting, I think with the help of the community hospital here, the community hospitals in Odessa, one of our, Mr. Landgraf's and I's competitors, Odessa Regional, has a van. It's roughly 25 feet long, and it does primary care. I've got the sniffles, I need some blood work, the doctor sent me to get this blood work, and they'll park at HEB, or they'll park at Stripes, or they'll park at the Dairy Queen, which is great for your diabetic screening, but...
Okay, no, wait just a minute. Is anyone here from Dairy Queen that has an objection to that? Go ahead, the Restaurant Association, go ahead.
I know what I buy at Dairy Queen, so it's not part of my gym membership. But those sort of things we looked at. Midland Memorial does a great job with patient outreach to the smaller areas. So does Medical Center. I see Mr. Landgraf shaking his head. We do certain things. We'll go to the health fairs at the smaller hospitals to let them know where we are. I use Big Lake for an example just because that's where I've been the last couple of times. And let them know, hey, San Angelo's got great care. We've got great care. Whoever meets the family's need is where you need to go. And what do we need to do to help these smaller towns out? We work real closely with the RAC organizations, which is Regional Advisory Councils. Try not to use acronyms. But those are some of the things that we do as far as outreach within our communities. Medical centers along the same line as us. I know you guys do a great job because we hear your stuff as far away as Midland and Odessa a lot of times. I think we do a good job of outreach, not to brag, but I think we do. But I think that we need to listen to the folks who send us the folks more, so to speak.
And the second part question is there a communication tool to reach everybody in this industry that would make you aware of the services that that all the hospitals have or all the clinics have? For instance, recently acquired helicopter from San Angelo Community Medical Center that sits in Snyder, or maybe some training opportunities that we have there one day that would be easy for your people to access.
I think if you can contact the Regional Advisory Council executive directors, such as Danny,
Yeah.
I can give you the information, or I can take it back to my Regional Advisory Council in Midland, Odessa area. Those are good. All of the Regional Advisory Councils have websites with all of the contact information. And if you can get that information out to them, the Regional Advisory Councils have members from each county, each hospital district, each EMS.
And that reaches the oil field directly?
No. Now that doesn't reach the oil field. To do that, I'm not really sure how we would, I would probably contact the West Texas Energy Consortium, who held a similar event to this a while back. Would be the only way I would know to get that out to them.
Plus, it could be that all this collaboration with DISHES, our Department of State Health Services, could have that information. Whether you could understand it and find it and be able to disseminate it from the DSHS website, that's another story. But this gives one more opportunity that I think that if the state has this information, there's no reason why the industry and healthcare people couldn't find it with regards. It's got to be collaborative in some way, and I think your areas are doing it. So that would be another next step, I think, for this group. I think we have time for perhaps one more question. We have 2 minutes, according to my very official clock up here. And here comes the last. She's either the last question or she's leaving. Yes, please.
Now, I'm Courtney Wardlaw with Devon Energy, and I really appreciate your comments because we have been long-time supporters of volunteer fire departments. And I think some of the comments you made today were sort of eye-opening for us. And you may have sort of answered this in the last question, but for the energy companies, how do we, because like I said, we've been very good at supporting volunteer fire departments, but how do we support volunteer EMS, and how do we get that contact information? Because, I mean, it's not, you can't just open the phone book and find, and that they are volunteers that are answering the phones, and you know they've got their personal cell phones listed. I mean, it's not easy to get a hold of all of you. So how do we do that so that we can?
Do you have a card? Do you have a card? Okay,
Yeah,
here it
I'll
is
give
right
you
here.
my
Here's the
card, and I
whole
can put you in touch
thing.
with all of the volunteer services you have in my area, and then I could put you in contact with the lady who has my job in the middle of the Odessa area, and she can get you the information for all of us.
Fantastic. That's what we need to be able to support you.
And thank you to Devon. You're a big wig in this
Thank you.
industry. Thank you for coming forward and verifying the industry and healthcare, and I hate
Thank
to
you
say
very
it, the
much.
government can work together. Thank you so much.
One comment
Yes.
about that, be honest.
Can you go to the mic, because the sun is blinding your voice. There you go. Okay, thank you.
All right, my name's Tim Riley. I'm the superintendent here for Devon in San Angelo.
Yeah,
And to be
another-
honest, to getting back to what you said, you know, we really thought some of those funds was going to the EMS. You know, we were giving to the fire departments, and we just assumed it was all going to the right spot. So I think there's a lot of that out, it's just missing information, and that's part of the reason why we come to these conferences, so we can learn something. And Devon, me and Court bought today, that I really wasn't expecting a whole lot out of this session.
Well, there you go. That's your fault, Representative Darby.
You never know. Getting back to the golden hour,
Yes, sir.
we are very aware of that. And one of the things that Devon does in particular, you know, we make sure we have GPS coordinates for all of our field crews, and we want to cut that response time down as much as we can, because we realize that hour. And it takes all of us. Obviously, I'd like to have a helicopter myself, but I don't have one of those. So we depend on other entities to come up with those helicopters. But I appreciate your comments, and I promise we're going to work towards that. Thank you.
Thank you.
Yeah, Phil Neighbors, San Angelo Chamber, and just one more piece I want brought out, Christy. I've heard you talk about the fact that now folks passing through on state highways, when they have an accident, it pings off of this cell tower or that, and you don't know where to send, you don't know where they are, because folks don't know where they've had a wreck, or even on the derricks if there's an accident. So any thoughts? Well, first of all, is it happening, and maybe how do we start addressing that a little better?
Yes, sir. I had a meeting yesterday with the Permian Basin Regional Council of Governments addressing that. And when you dial 911, if you're in a rural area, so that everybody understands, if depending on where you are and the capability of the cell phone towers and the cell phone companies, your call will either come in as a phase 1 or a phase 2 call. If it's a phase 1 call, then they can pinpoint you within a 50-mile radius. If it comes in as a phase 2 call, depending on the cell phone carrier. Then it comes in and it will tell you exactly, it will tell the 911 dispatcher exactly where you are. So the best thing that I can say, and he mentioned it, have your GPS coordinates available, which I know that sounds crazy and most people go, how am I going to do that? Your cell phone. Most of you have a smartphone. If you have an iPhone, it has a compass. If you'll hit that compass button, it will give you your exact GPS coordinates at the bottom. It tells you exactly where you are. If you can give that 911 dispatcher that information, they can pinpoint you to exactly where you are. That also comes with knowing your area. Know where you are. I can tell you that I know that a lot of those guys out on the oil rigs have no idea where they are. But if they can get an address, get an idea, and then they can call in and actually tell somebody exactly where they are when that happens. Be aware of your surroundings. If you're driving through and you're in an automobile accident, know where you are. Pay attention. That's the best I can say.
That's great.
Okay, Chrissy's correct. I'm looking at my phone. I probably need Brooks Landgraf to help me read this, but it does appear to have the coordinates at the bottom of the phone. So good tip. That's fantastic. If you find a place, because I know I've called in trucks trying to run me off the road, and they said, where are you? I said, I have no idea. So now I can do this. So thank you so much. And again, please honor this panel who have brought together. And thank you to Devin in particular for your leadership and stepping out. It's been a great panel here. Thank you.
Representative Susan and panel, thank you. Obviously, this is an area that we need to return to. Phil and I just whispered to each other a little bit ago, and I'm sure that Drew will agree. We need to bring this back and expand it. You guys have just touched the surface of something that's very important. Here's another growing pain of all this success that we're having, and we promise that we'll try to get more involved, and maybe you people can come back, spend a little more time. But at any rate, thank you very, very much.
Thank you. Thank you.